Question 4 asks, how do we classify mental disorders in the United States, and what are the pros and cons of this system? Now, we classify mental disorders using the DSM-5. That's the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, and this is created by the American Psychiatric Association and updated every decade or so. Now, pros of the system is it gives clear-cut diagnostic criteria that psychologists can follow to identify signs and symptoms that lead them to make a diagnosis of a certain psychological disorder. And this is good. This streamlines the process and allows psychologists to more efficiently diagnose their patients. Now, cons of this system is that sometimes the streamlining can go too far, where it starts to muddy the waters and it becomes difficult to determine who has what. An example of this would be with Asperger's falling underneath the umbrella of autism spectrum disorder in the newest edition. In addition to this, groups such as the National Institute of Mental Health even reject the current version of the DSM. So the credibility of the entire atlas itself is sort of up in the air. Question 9 asks, do you believe it's true that chemical imbalances in the brain are the cause of mental disorders? And my answer to that is that some disorders more than others more heavily rely on these chemical imbalances triggering the onset of a psychological abnormality, but while others follow the idea of the diathesis stress model, where even if all of these other dispositions were in place, without a stressor event, the psychological disorder wouldn't manifest in the individual. Or in the case of, say, PTSD, without the predisposition genetic influence of a smaller hippocampus, it also would fail to manifest. And in addition to this, I think that simply boiling down mental disorders to chemical imbalances takes some of the agency away from the individual suffering from the affliction. And I think it also takes away from some of the credibility of cognitive and behavioral therapies, where it really focuses on the individual trying to better themselves and conquer their disorder through their mental thought processes. Question 10 asks, what does it mean that depression and socioeconomic status are negatively correlated? And what this doesn't mean is that socioeconomic status causes depression, but simply that those in lower socioeconomic statuses have been observed to have higher rates of depression. And this doesn't also mean that those in higher socioeconomic statuses are incapable of developing depression, nor that by simply being in a low socioeconomic status you will develop depression. Now, this makes sense, as those in low socioeconomic statuses are often subjected to higher rates of chronic stress, which, unlike sporadic acute stress, which can be good for the body, is a huge drain, as it causes the body to divert energy away from important functions like the immune system, and instead focus on the task at hand. Now, this is all relevant, as chronic stress is one of the biggest determinants for the development of depression. So in a way, being of a lower socioeconomic status provides a very fertile environment for the development of depression. And for this reason, it makes sense that this correlation would exist.